Have you ever got a high-grade fever with chills? Have you felt extreme body ache and extreme severe generalized weakness? And were you hospitalized for the same? If yes, there are high chances you must have suffered from dengue, or more commonly pronounced as dengue. Hello friends, I am Dr. Mehta, a consultant physician, diabetologist and a critical care specialist, and you are watching Doctor Plus, where I'll be your doctor plus something more, and we'll be talking everything about good health and everything good about health. So, why is dengue a major health hazard in India? Why do we have to be extra cautious and more vigilant while treating patients of dengue? And how is dengue different from other diseases? We'll be talking everything about this in detail in this video. You get a bite of Aedes mosquito and a week later you start developing extreme high-grade fever, severe generalized weakness, complete loss of appetite. These were the symptoms of dengue, and these are very common during the monsoon season. You will be surprised to know that the body ache in dengue is so severe that it is also known as break bone fever. So let's talk about the first question. Why is dengue a major health hazard in India? The most common reason is the vector of this disease, that is Aedes mosquito, which breeds itself in the stagnant waters which frequently occurs during the monsoon. And that is why most of the cases that we find for dengue patients are in the monsoon season itself. The other thing which makes the spread of the disease fast is the nature of its vector. That means the Aedes mosquito are also known as nervous biters or fearless biters. That means they are not scared of humans at all, and they can bite you even during daytime and even while you are moving out of your lift or getting into your vehicle. So you have to be very careful if you have a breeding site of the dengue mosquitoes in or around your residence. Moving on to the next question is why you have to be extra cautious and more vigilant while treating patients of dengue. A lot many reasons. Number one, dengue doesn't have a specific treatment. We still don't have any cure for dengue. So you have to literally wait till the virus evacuates your body by itself. And this duration is around 8 to 12 days. And the complications that might occur related to spontaneous bleeding, organ damage, and severe hypotension, that means a significant drop in blood pressure, might occur, and that makes you vulnerable to the complications of the disease, and it might even cause death of the patient. Yes, it's very shocking to know that a mosquito bite can cost you your entire life. So we have to be always one step ahead while treating patients of dengue. Moving on to the third question, how is dengue different from other diseases? Again, a lot many factors. Number one, dengue is a part of the viral hemorrhagic fever where there are high chances of spontaneous bleeding. That means leaking of the blood from the blood vessels, which significantly reduces the blood pressure and which might cause kidney dysfunction and liver dysfunction in form of multiple organ failure, and that might cause fatality. Second, it almost always requires hospitalization for two reasons. A, intravenous fluids are the only most effective supportive form of therapy, and these intravenous fluids significantly retard the progression and complications of the disease. And B, it significantly controls the symptoms, that means the body ache and weakness, which almost always accompanies dengue. Also, it is very important to note that even with severe body ache and weakness, it is not advisable to consume over-the-counter painkillers because they are known to complicate the disease and significantly reduce the platelet counts. You will be surprised to know that if the platelet counts drop below 20,000, those patients might require platelet transfusions. And it is very common for blood banks to run out of these platelet stocks during the monsoon season. So I would suggest that if you regularly donate blood or someone in your family regularly donates blood, make sure that you donate blood especially during the monsoon season, because this is the part of the year where scarcity of platelets is very common, and it always becomes tough to treat dengue patients without the support of platelets. So coming to the last and the most important point, how to treat dengue. First, make a visit to your doctor as soon as you find the symptoms that I initially mentioned. That means fever with chills, extreme body ache, weakness and loss of appetite. Now if the dengue test comes positive, take adequate complete bed rest and medications. If the platelet count drops below 1 lakh, you must get hospitalized and intravenous fluids should be started as soon as possible. The platelet count should be regularly checked at least daily, and if it is below 20,000, that patient might require platelet transfusions and the patient needs to be hospitalized till a rising trend in the platelet starts. The most important parameters that we doctors observe in the patients of dengue are blood pressure, urine output, liver function, kidney function, and absence or presence of bleeding. It is very striking to note that bleeding related to dengue could be so severe that it becomes very tough to control the bleeding, because that bleeding is almost always internal, and that is why complications are really high if the bleeding starts. So this was all for today. I hope all your doubts and questions about dengue are now clear. Hello friends, I am Dr. Mehta, a consultant physician, diabetologist and a critical care specialist, and you are watching Doctor Plus, where I'll be your doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease. I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.